Hello everyone, I'm Dr. Suresh, Senior Consultant Maxillofacial Surgeon from Gnathos Facial Surgery. If someone has got a facial bone injury, the next question you should ask your doctor is when is the best time to operate or fix the facial bone injuries. A simple injuries need not be hurried, they can wait and watch. If it is a complex injury, then the challenges comes. Identify which facial bone is injured and what are the structures involved in the facial bone fracture. Facial bone fracture is minimally displaced, then you can opt for non-surgical methods like restriction of the movement and rest to the facial bone fracture. That itself will heal the fracture bone. If someone has got a very displaced facial bone fracture, then the surgeon should identify what is the level of displacement and how to correct the facial bone into the normal anatomical position and the fixation of the facial bone fracture. Usually, these fractures heal very fast. So, if within few weeks the fracture bone can heal in even displaced position also. So when someone has got a displaced fracture and it is not intervened in a proper time, then the fracture heals in a wrong position, thereby affecting the life of a person. So if there is a displaced fracture, at the earliest, once the patient is safe to undergo the surgery, at the earliest, operate the facial bone fracture, bring the fractures into normal position and fix it with the mini plates and screws. Then the fracture heals in a proper fashion, and then at a long term, the patient will not have any challenges or any difficulties in the day-to-day life. Now, what can you expect after facial bone fracture? First is immediately the patient should recover from the anesthesia. Usually, it takes 4 to 5 hours the patients to recover from the anesthesia. After the patient recovers from anesthesia, immediately the patient should be able to open his mouth, chew his food, at least soft diet normally. If the patient is unable to chew his food after the surgery, that means there may be a displaced fracture or the fracture fixation may not be open. Gone are the days where the facial bone fractures were treated using wires and where they used to tie the mouth and allow the patient to stay on liquid diet for a few weeks. This, with modern advances in the scientific techniques, it is almost absolute. In recent times, we are not putting any patient on fixation of the jaw bones where the patient will not be able to eat his food normally. Immediately after the surgery, once the fracture bone is fixed properly, within 4 to 5 hours after the surgery, the patient can eat soft diet normally. Now, deformity of the jaw bones. If the fractures are displaced, then they are reduced in a proper fashion and fixed, there will not be any deformity in the facial form. Next question patients usually ask us is scars on the face. As a facial surgeon, we are not supposed to make any ugly scars on the face. So your surgeon will choose such a methods or such a techniques where the scars are hidden into the hairline or the eye or inside the mouth where the scars are not visible. At the same time, we can properly fix the facial bone fractures. Thereby, we can maintain the aesthetics of the face, the functions of the face, chewing ability, and proper functions of the jawbone. Thank you. If you find this information is very valuable, please follow this channel and share this information to the needy people.